So if you're nervous about folliculitis after a hair transplantation, these are a few tips that can help you. I'm Dr. Anthony Farrell. I'm the director of Philadelphia Hair Restoration. I experienced folliculitis after my third procedure. It really isn't that bad. What is folliculitis, first of all? So folliculitis is generally you may run your fingers through your scalp or hair and feel a little bump now and then. And this is not something you should do. It's, as we discussed before, you don't want to pick at scabs right after the transplantation. That's not folliculitis. What folliculitis is the follicle itself that's been transplanted sometimes gets buried and cannot escape a hair. A hair follicle can't grow outside of it, so it causes an inflammation, almost like a small pimple. And then you're going to feel something that feels a little scabby, and if you just run your finger over it a little bit, you're actually going to burst what feels like a tiny little pimple, very, very small. And that's folliculitis. It doesn't happen throughout the entire scalp. It happens just focally in very few areas here and there. So even if you don't have a hair transplantation, you can experience folliculitis. People that have large pores in their skin experience more acne. They can get more sebaceous cysts, for example. So folliculitis can be best managed by good hygiene. What does that mean? It means washing your hair regularly and rinsing well and let the course take it. Folliculitis does not require medications of any kind. So how do we tell the difference between folliculitis and post-transplant irritation? Well, the timing is the most important part. We don't get folliculitis by and large in the first month after transplantation. It's only after the hairs have been buried for a while or implanted that folliculitis can occur. So the timing is really the big issue. You're not going to experience folliculitis until usually at least a few months after the procedure. But know that the folliculitis can go on indefinitely, even years after the transplantation. Again, it's so minor. And again, being a recipient myself or having experienced folliculitis, I will go 6 months or greater without any evidence at all. When I say evidence, feeling and you can only tell really when you put your hands in your hair. It's nothing that you feel. You might feel a little itch now or then, but hardly. So that's the main difference between folliculitis and post-implant scabbing. They're totally different animals. If somebody experiences folliculitis after a hair transplantation, what do we do? Well, number one is not to panic. It's common. Don't worry about it. Secondly, if you experience it, you can talk to one of us who has done the hair transplantation, and we'll tell you some of the things you can do to help it. One of the things is to maintain good hygiene, hair hygiene. Wash the hair, rinse the hair. You can sometimes use medicated shampoo, and you can keep that folliculitis, which is really a name that means inflammation of the hair follicle, down to a minimum.